What age?
Well, the age actually, it starts to sort of go up a little bit at 14, 15, 16, 17, turns rather sharply if you're looking at this as a graph, 18, 19, 20, 21, 22, 23, 24. And so there's this turn upwards. And then then the suicide rate, and that's the number per 100,000, that's what we would use, sort of levels off in the mid-20s, stays pretty level, a little bit down, all the way to the mid-50s, kind of goes down a little bit in late 50s, and then turns way upward in later life, and that's older white men in particular. And it's very clear that, there are different patterns at different points of the life course. Depending, it's almost like it picks different parts of the population. People suffer.
What do the younger age level and the older age level have in common? You know, there's a pop at one age and then older.
Well,
what do they have in common?
Psychologically, they're probably very different. Very little, I suspect.
Very little in common. I expected that you'd say stress, but you
didn't. Well,
yeah.
stress is there for everyone.
Okay.
I mean, you have stress. If I have stress, it's the issue of often lack of protective factors. You know, one of the things that we always talk about are risk factors. You know, risk factors is a population term. In a population of people, are there things that would increase the likelihood of an outcome like death by suicide or heart disease or cancer? Protective factors are the things that may act to prevent that.
Like somebody there who loves you?
Exactly. Or somebody there who's going to, you know, when you start to become that isolated youth, somebody who puts his hand on your shoulder and pulls you back. When those protective factors we often think of are social. They could be important persons, they could be important organizations, they could actually be something in the person. There could be, you know, some people are in a mess, but they somehow figure out how to get out of it.
Why is it so important from the perspective of suicide prevention that there be someone in this child's life who deeply loves them?
Well, you're asking one of those sort of fundamental questions that goes way beyond suicide. Why is it important that anybody feels loved? And that's how we often develop our sense of self-value and self-worth, our sense of who we are and that we mean something in life. You know, and I think that...
So to recap that, you're saying that your understanding of your sense of who you are is heightened by a relationship where you're nurtured.
A positive relationship.
Okay.
Now, because remember, there are some kids who start to drop out of school, and their biggest, I'll put it in quotes, positive relationship maybe with the gang. And that may be ultimately a negative factor, even though they get a kind of self-esteem from it. So it is a social factor, it is a social force. If a kid's on the edge and starts missing school a lot, well, what do you think they're doing in the day? You know, if they get suspended or expelled from school, it isn't like they're just sitting, you know, at home alone. And so one of the things that we see is that social network and social forces can be very, very valuable. And so
are divorce rates being higher than they were 50 years ago part of the problem here? Does that affect how much support that child feels they have?
We've got to be careful. If we look back, and the reason I say that is we look back at the suicide rates across the 20th century, the highest rates were in the Great Depression. They were stunningly high. They then dropped during the World War II period. And then between the 1950s and now, they've almost been level. They've dropped a tiny bit. And tremendous things like the divorce rates have changed. The suicide rates haven't changed so much in the face of that. There have been differences, though, when you dig in different groups. So the kids' rate started about 30 years ago to go way up. You know, I say kids, I'm talking about 18, 19, 20, 21. So
ladies and gentlemen, we're going to be right back after this break with more on the crucial topic of suicide prevention. We're back with Dr. Caine talking about suicide prevention. Let's talk a little bit about the middle years.
Sure. Well, you know, that's the big hidden iceberg. You know, in the United States right now, when we talk about suicide, as we have been, we tend to talk about kids. But in fact, the rates are well, low compared to the middle years and the later years of life. Maybe it's most sad when we think of somebody who's 17 or 18 losing his life or losing her life and saying, oh, a life lost. But if you look at the cumulative effect on our society, the bulk of suicide and its impact is in between 20 and 55. And there was recently a report from the Centers on Disease Control pointing out how in the in the middle age, you know, the sort of 25 to 55, the rates have gone up very significantly in the last, between 1999 and 2004. And this is the working age, this is the parent age, and these are folks who, while they have distress and depression, as we talked about before, and substance use problems, the vast majority were not people seen in psychiatric settings or mental health settings. They were people out in the workforce, people as parents, people who have been affected by job loss or unemployment. One of the things that's hard to get our hands around at an individual level when we see a person and we're trying to help that person stay alive is that there are big trends that actually affect the population as a whole. An example would be in the late 90s in Asia, you know, there was a big economic downturn in Asia, not different than ours. A housing bubble, real estate values went, everything dropped like a stone. And that was in 97, 98, and the suicide rates in places like Japan, Hong Kong, Taiwan went dramatically upward, and it all was accounted for by people in the middle years. And indeed, these were the people who were laid off, they were marginally employed, they felt terrible about their families, they felt terrible, embarrassed, they really had a loss of face, a loss of self-esteem. And you know, their job of many years was turned upside down. And it's, you know, in our country, it's a bit different. When we hear that a corporation is downsizing or resizing, you know, the stock price often goes up. And we say, that's what they're doing to you know, bite the bullet and deal with the market and deal with the economy. And it's important. I'm not saying that that's not a real life concern. On the other hand, it's hard for us at a distance, and those of us who have jobs, to see what's happening to the person who's laid off and who for the first time in his life is unemployed or loses her house.
How would you know if you're the individual experiencing the feelings or you're watching a loved one? How would you know where somebody's going over an edge of normal thoughts that aren't so positive about their life into a state where it's depressive thinking? What does that line look like that you cross?
It may be hard to, it's a hard line to tell. I think that, and we don't want family members to think that they have to be the expert. What we want family members to do is to encourage loved ones, by talking with them openly, to get help. And so it's more, gee, do you feel like there's nothing you can do anymore? Do you feel like you've lost control? And these are the kinds of questions you can ask. Have you thought that life isn't worth it anymore? Or you listen with that sort of extra ear, you know, the kind of, you know, is he really saying that he's more of a burden than a help? You know, one of the...
It sounds like if you hear words in your own mind, because we all talk to ourselves kind of, or from a loved one that say, it isn't working for me in my life. You know, I can't handle it, or it's really not so much I have a problem. People have problems all day long and they talk about them. I don't like the way my hair got cut. Of course, I don't have that one. And
I'm quickly catching up. So.
Okay, yeah. Well, you know, God took half and I helped him with the other half.
Yeah,
that's my line.
Well, I haven't come to that point yet.
Okay. But when you talk about somebody who's communicating about these thoughts or whatever, I mean, again, how are you going to know as an individual that you're crossing into a thought pattern that could be dangerous?
Well, let me sort of put it this way. Again, this is one of those I don't know things. None of us know that with great specificity. And the point of some prevention programs is not, and this is really the wave of where they're going, is not to say that you could pick out that individual or that individual, but to say, hey, if there are a group of individuals that are feeling despairing, let's not try to get the 1 out of 100 or the 1 out of 1,000, but let's go help the whole group that's feeling despairing.
For more Medical Matters television shows, go online to medicalmatters.tv.